At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. An ankle injury diagnosis chart is a structured clinical tool that guides healthcare providers through a step-by-step process to accurately assess and diagnose ankle conditions. It begins with an initial patient evaluation and proceeds through physical exams and imaging studies. This systematic approach helps clinicians eliminate other possible conditions and pinpoint the exact cause of ankle pain, leading to efficient diagnosis, comprehensive care, and timely treatment. Recognizing symptoms is essential for early diagnosis and treatment. Common signs of ankle injuries include pain and tenderness, swelling and bruising, limited mobility, instability or difficulty bearing weight, a cracking or popping sound, crepitus. Injuries may result from various causes such as high-impact sports or activities, previous ankle injuries, anatomical abnormalities, sudden twisting or trauma, aging-related wear and tear. However, not all ankle pain stems directly from ankle injuries. Conditions like turf toe, anterior ankle impingement, or plantar fasciitis can also cause discomfort in the ankle area, often overlapping with foot pain. Diagnosing ankle injuries involves a detailed 4-step process. Step 1, initial assessment. A trauma-based evaluation following the ABCDE protocol: airway, breathing, circulation, disability, exposure. The provider checks for visible injuries and assesses circulation, nerve function, and motor ability in the ankle. Step 2, history taking. The practitioner gathers information on how the injury occurred, the nature and duration of symptoms, and any relevant medical background, including prior injuries or chronic conditions. Step 3, physical examination. The ankle is visually inspected and palpated to identify swelling, bruising, or deformity. Movement tests assess the joint's flexibility in all directions. Additional stability, strength, and comparison tests with the uninjured ankle help refine the diagnosis. Step 4, imaging tests. To confirm the diagnosis and assess the extent of the injury, the healthcare practitioner may consider ordering imaging tests. 2 examples of such imaging tests are X-rays, which check for fractures or dislocations. MRI scans provide a detailed view of soft tissues like ligaments and tendons to detect subtle injuries or internal damage. Ankle injuries can significantly impact mobility and quality of life, but timely and appropriate treatment can facilitate recovery and prevent long-term complications. You can learn more about topics like the ankle injury diagnosis chart in our guides library on our Carepatron website. Visit our website and sign up for free. If this video is helpful, don't forget to like, subscribe, and check out more of our content.